Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador COVID-19 briefing for today, Wednesday, November 18th, 2020. I recognize that things are changing quite quickly. Seeing new travel-related cases in the province as cases spike in other parts of the country can certainly be nerve-wracking. It's incredibly important that we continue to follow public health guidelines. Thanks to the diligence of Dr. Fitzgerald and her team in public health and the leadership of Minister Haggie, we are the envy of many jurisdictions. We want to stay that way. So on that note, Dr. Fitzgerald will share her update.
Thank you, Premier. Good afternoon, everyone. So I'll start with an update of COVID-19 in the province. And since the media advisory yesterday, we have 2 new cases. The first is female over the age of 70 and a contact of a recent case. The second is male between 40 and 49 years of age and is travel related. The total number of cases in our province is 307. 294 people have now recovered, and in total we've tested 57,510 people. While we have done very well in keeping COVID-19 under control in our province, it is going to take the collective unwavering efforts of each and every one of us to keep it that way. We can see from other jurisdictions who, like us, have done everything right in trying to keep this virus at bay, how a single case can quickly spread. I liken this pandemic to a tsunami. There's a tsunami of COVID-19 just outside our shores, and we must do everything in our individual power to keep it that way. Unless we each do our part, we will not be able to keep the virus under control. Travel restrictions and self-isolation are not enough to keep COVID-19 from spreading. Just as this virus is relentless, we must be as well. Please maintain your physical distance from others and stay within the bubble of your closest family and friends as much as possible. Stay home if unwell, cover coughs and sneezes, practice proper hand hygiene, and wear a non-medical mask at all times in public spaces. Indoor public spaces, sorry. It is not one, but the full combination of these measures that will provide our absolute best defense against this virus. If we think we can outsmart it by just relying on one of these measures, we are sadly mistaken. So while we are restricting who enters the province as much as possible because we know that travel brings the virus here, it is impossible to shut down travel completely. And there are many reasons why people must travel here, including essential workers who, because of the nature of their work, are not able to completely self-isolate. And it is vitally important for people entering the province, be it essential workers, rotational workers, or otherwise, to follow all public health requirements and limit close contacts as much as possible. Travel may be what brings the virus here, but it is social gathering, failing to self-isolate, and not following public health guidelines that spread it. Many other provinces and jurisdictions are into a second wave, so please be reminded that all non-essential travel should be avoided. Nova Scotia recently reported an outbreak, community spread, and if travel to that province is required, please follow any and all public health guidance in effect in that province. While there, please limit the number of close contacts to as few as possible, maintain physical distancing, and practice frequent and proper hand hygiene and respiratory etiquette. Travelers to Newfoundland and Labrador from Nova Scotia for the first 14 days after arrival should self-monitor for symptoms of COVID-19 and contact 811 to arrange testing if symptoms develop. While our public health system is doing its very best to help keep you and your loved ones safe, it is your unwavering actions that will make all the difference in how COVID-19 looks in our province in the coming weeks. As the Christmas season approaches, following public health guidance and restrictions will be more important than ever. And the holiday season is traditionally a time for gathering and celebration. However, like every other occasion celebrated in the last 9 months of this pandemic, this year is different. In order to keep you and your loved ones safe, please remember 20 for 2020. This means limiting gatherings this holiday season to a maximum of 20 of your closest family and friends. By now we know that with sacrifice and a little creativity, we can still find ways to connect with the ones we love during the holiday season and stay safe while doing so. This will truly be the gift that keeps on giving. If you are planning or attending festivities this holiday season, please continue to be mindful of people, space, time, and place. Simply put, the more people you interact with, the greater the risk of spread of COVID-19. Gathering spaces should be large enough to allow physical distancing. Let the size of your space determine how many people you can safely accommodate. But remember, this should be no more than 20 close, consistent contacts. Please also remember the risk of infection of COVID-19 increases as people spend longer amounts of time together, and spending time together indoors is more risky than spending it outdoors. While we know this has been a particularly difficult year for workplaces and staff, and understand employers may want to recognize and thank employees for their contributions, hosting a workplace Christmas party this year is not really the way to do it. This also includes planned celebrations by workplace social clubs and informal gatherings of co-workers. I encourage you instead this year to find other creative ways of recognition and thanks, such as purchasing a gift basket or another special token of appreciation. If workplace parties are being planned, organizers must be mindful that employees are likely not close, consistent contacts within each other's bubble, and therefore should maintain physical distancing at gatherings, even if seated for meals. And for detailed guidelines on holiday events and gatherings, please visit gov.nl.ca/COVID-19. It has come to my attention that we are seeing an increase in the number of concerns in bars, restaurants, and other public indoor spaces in not providing enough space for customers to maintain proper physical distancing. Owners and operators of these establishments are reminded that the holiday season is not the time to relax public health guidelines. These measures are in place for the health and safety of both staff and patrons and must be strictly adhered to. These concerns are being followed up by environmental health officers and liquor enforcement officers and are taken very seriously. And should these complaints continue, we may have to consider amendments to our existing special measures orders to strengthen them accordingly. As a recap for those who may have just joined, we have 2 new cases since yesterday's media advisory. The total number of cases in the province is 307. I think it is more than fair to say we are all fatigued by COVID-19 and the changes and personal sacrifices we have had to make to navigate this pandemic. But a vaccine is on the horizon. We are so close to reaching the other side, and this fills me with hope and optimism for a return to safer, more normal times. Another wave will only slow our progress and set us back. But if we continue to be mindful and vigilant, I believe we can hold it off. We just have to hold on a little bit longer. The end is really in sight. We can do this, Newfoundland and Labrador. Like all other times in our history, when the chips are down, we always rise to the occasion. So hold fast. Thank you. And don't forget to get your flu shot.
Thank you, Dr. Fitzgerald. Let's keep those with COVID-19 and their loved ones in our thoughts and prayers and wish them a speedy, full recovery. Newfoundland and Labrador, your tireless dedication to protecting yourselves and each other from the spread of COVID-19 is nothing short of phenomenal. Our province is the envy of many around the world, but that is only because you respect public health guidelines, which is combating the spread of this terrible virus in our province. So thank you. We owe a huge thank you to Dr. Fitzgerald and the whole team at Public Health who are navigating this challenging time with patience and skill. As COVID-19 outbreaks arise in other areas, it's even more imperative that people continue to follow the rules here at home. I have to ask you all to do something right now, and that's very simple. Keep up what you've been doing. Our neighbors across Canada face spiking COVID-19 cases in the second wave. With heightening public health restrictions and lockdowns, it's tough to see. Our friends and family members are in those communities. They can't come home for Christmas the way some had planned. And we're asking Newfoundlanders and Labradorians to avoid traveling elsewhere. We can't have the big series of celebrations we're all used to and so thoroughly love. As Newfoundlanders and Labradorians, we know the value of getting together. But the wonderful thing is, we still can, in new, respectful ways, following public health guidelines. We can have those seasonal get-togethers. We can celebrate safely, respecting the advice of Dr. Fitzgerald. And that's something I know my family and I are very grateful for. You could see it this past weekend with Diwali celebrations, honoring traditions just in a different, a COVID-19 way. When it comes to planning gatherings in everyday life, remember, as Dr. Fitzgerald said, people, space, time, and place. The more people you interact with, the higher risk you have of spreading COVID-19. Maintain a safe physical distance. Risk of spread increases as people are together longer and in indoor places, which is way more riskier than outdoors. Wear a mask. Wash your hands for 20 seconds and use hand sanitizer when necessary. It can't be stressed enough. We recognize that these are challenging times. The anxieties of the global pandemic may start to feel heightened. Please know that any of the feelings you have are valid and real. You're not alone. Please talk about it. Please avail of resources. There's a lot going on, and your own mental health may not seem like a priority, but it is. It absolutely is. Let's do our part to be kind, to support our communities as we've been doing for so long. Together, we are stronger when facing this virus. I hope you can look at whatever disappointments you may feel and recognize the value of these public health measures. Recognize the value of the sense of normalcy and economic activity we now enjoy in Alert Level 2. By keeping up what we've been doing, we can keep COVID-19 under control. The epidemiology changes, and we need to remind ourselves frequently that we need to be ready to change too. Even if we can't avoid a second wave entirely, we can slow it, maybe even delay it. And as hope for a vaccine is on the horizon, we can reach it. And this is really important. We can all get our flu shots to help the healthcare system handle whatever may come. My whole family went to the Eastern Health Flu Shot Clinic here in St. John's, and it was great. The staff were fantastic. So thanks to all of them for making the experience a positive one for all of us. I know many of you have done the same and are taking the time to get a flu shot in whatever way you find most convenient. But Newfoundland and Labrador, it's not enough. More need to get flu shots. Remember, it's not just about you. It's about protecting others. It's about your nan, your pop, your newborn baby, your brother's 6-month-old. And hey, it's great practice for the COVID-19 vaccine that we all anxiously await. Take care of yourselves and each other, and together we will get through this. Respecting the virus while caring for each other is a line that we have walked well. So let's continue to walk it together. Minister Haggie will now share his remarks for today.
Thank you very much, Premier. It is day 256 of our media availabilities and the state of public health emergency. Before I get into my specific comments, I'd like to give a shout out to Vera Pauline Society. They made some buttons with COVID-friendly slogans on about staying in your bubble, and they're available from their button shop. I'd like to thank them and appreciate the work they do. We support them through the Department of Health, and it's well worth the opportunity if you get a chance to purchase some of these. On a sadder note, it is a National Day of Remembrance for the victims of road crash accidents. Like my colleague to the left, having spent a long time looking after the consequences of these events as a clinician, and also for a decade as a deputy medical examiner, I can't stress the distress that these events cause. So drive carefully, particularly as the weather changes and the highways become less predictable. The last week I would want to recognize today is Antimicrobial Stewardship Week. It sounds like a mouthful, but this province actually uses 2.5 times the prescription rate of antibiotics per person for antibiotics. And particularly in cold and sniffle season, I think it's only reasonable to point out that we need to look at our usage and our overusage, because in time this will become another major public health challenge if it's left untouched. Having said that, on an operational note, once again, I'd like to draw people who live in Eastern Health's attention to the fact that if you want a home flu shot, please put 1-800 in front of the number that's listed for Eastern Health. Otherwise, the senior citizen who will answer that other 7-digit number will not be able to help you get your flu shot, and she's running out of patience. So please, 1-800, then the 7 digits. We have done well thus far with flu shots. As of yesterday morning, we have administered 167,000 flu shots through various routes. That compares with 123,000 this time last year. We have another 50,000 appointments booked over the next 30 days only. And if that's as far as we get, that's still 42% of the population vaccinated, which is a record year. We need to do better. We really need to double that. But given the fact we're really early on in the flu season, I'm encouraged. Our documentation and our systems are working well, and I think we will be ready for the COVID vaccine as it rolls out hopefully at the end of the first quarter next year. Again, it won't be available immediately for everybody. We will start with high-risk and vulnerable groups and essential workers in keeping with the recommendations of the national body about guidelines that we've all signed on to. It has been a challenge, and Dr. Fitzgerald and the Premier have alluded to it, to kind of keep the faith over the course of the last 9 months. And I've said many times this is a marathon, and we do need to be persistent as well as patient. It has paid off, and we are in a better position than a lot of other provinces and a lot of other countries, I would argue. We do this by layered defense that Dr. Fitzgerald has described. Each on its own is a thin layer, but put together like a laminate, it provides a strength that each layer on its own cannot. And that is the importance of each of those measures. So it is the importance of the travel restrictions, it's the importance of being responsible with your isolation, it's about wearing masks in public, and all the other public health measures that Dr. Fitzgerald has outlined. And we each have our mantra, but at the end of the day, I think by now, after 9 months, that material is out there, and we really have no excuse for not knowing. We just have to put that knowing into doing. So with that, keep the faith, hold the line, and we will get through it. There is a light at the end of the tunnel. It will not come as quickly as we want, and that is where that persistence is important. So I think with that, Kathy, I'll wind up my comments and hand it back to the Premier. Thank you.
Well, thank you, Minister. Certainly we can open it up from questions from the media at this point.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you very much. In some of the comments earlier, you mentioned that you've been hearing some complaints in relation to bars and businesses. I was just wondering if you can sort of elaborate a little bit more on the specific complaints that you've been receiving, and do you anticipate that there could be any repercussions laid against those businesses?
So all we've been hearing is just about physical distancing, and that perhaps once once people are in, that there's not quite enough distance between tables for people to feel like they're physically distanced well enough. So some concerns in that regard. So, you know, education is our first step in trying to correct concerns like this. So that's the job of environmental health officers and some of the other inspectors that will be going in.
Thank you. And over the weekend, we saw a case regarding a rotational worker from Russia at the Lower Churchill project. And similarly, a few months back, we saw a case regarding an essential healthcare worker from Saskatchewan that traveled to Happy Valley Goose Bay for work. These are 2 cases now of essential workers coming in with the virus. I was wondering if there is any consideration being given to changing the regulations regarding essential workers coming into the province.
So we are examining the process for essential workers and essential healthcare workers coming into the province. Those recommendations are not finalized at this point, but we have been looking at things.
Thank you.
Our next questions are from Mark Quinn of CBC News. Please go ahead.
Yes, hello, thank you. Nova Scotia says it has 7 cases that can't be linked to travel, and they're concluding that those cases may be from what they called local transmission. We have a case, I think, correct me if I'm wrong, where we don't know the source of the transmission as well. And I'm wondering, what does this mean to us? Are we looking at tightening restrictions, or perhaps even excluding Nova Scotia from the Atlantic bubble?
So certainly, we don't have any cases at the moment where we haven't been able to localize the source. So I think yesterday we said the case was under investigation, but we have been able to discern what the source of the infection was. So, so right now we don't have any cases like that. Certainly, you know, we've asked that people be careful when they're in Nova Scotia and to limit travel to essential travel, and I think we're all sort of recommending that now at this point, just with everything that's happening across the country. But at the moment, you know, we're not considering changing the Atlantic bubble.
And as a follow-up, you mentioned you've identified, or public health has identified, the source of that case yesterday. Can you say what the source was?
So the contact with a traveler, yeah.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I also have a question regarding essential workers. It's one that's been asked time and time again when it comes to point of entry testing. If this is another tool that we could use in our toolbox, why not utilize it?
So it's, when we're talking about things that we can use, just because we have a test that we can use, we have to make sure we're using it properly. Point of entry testing is not something that we can use for everybody. We have to look at how we use that judiciously. It's not the be-all and end-all with regard to, you know, if somebody tests negative, then they're able to leave and there's no risk of them developing symptoms or becoming positive at some point down the road. We know that that certainly can happen, and jurisdictions that have implemented this process in the past have found that that is indeed the case. So, you know, we have to look carefully at how we can use that. There's logistical challenges with that. So we do want to make sure that any policy we bring in with regard to testing is done based on evidence, and that will provide us with the best information that it can.
And I have another question regarding rotational or international rotational workers. This is coming from the wife of an international rotational worker. They're wondering how essential workers can be allowed in, for example, from Europe or areas like that, where they don't have to necessarily self-isolate right away. I know there are other protocols in place, but they don't even pay taxes here, yet international rotational workers who do pay taxes here are very limited on their freedom. They can't even go out for a walk.
So there are two different issues, and they're both governed by orders in council at the national level, because people are coming in. So people who are deemed essential workers are one group, and people who are coming home from their place of work are considered in a different category and are therefore required to self-isolate. But those are regulations that are outside of our purview here at the province.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi there. I have another question related to travel. The 3 other members of the Atlantic bubble, so New Brunswick, Nova Scotia, and PEI, are all allowing family members from the rest of Canada to visit, whether over the holidays or not, so long as they isolate for 14 days. Correct me if I'm wrong on this, but that doesn't seem to be the case in Newfoundland and Labrador. Can you explain why we're the odd ones out on this?
So we had not made those changes. The other provinces had made changes. New Brunswick and PEI in particular had made changes over the summer. We did not. And we had looked at this, as we discussed last week. We had looked at that option, but we felt that at this point in time, it was not the right time to do it. You know, we'll see what changes may come with the epidemiology elsewhere in the country in the future, and that may be something we reconsider at some point down the road, but at this point we didn't feel that it was the appropriate thing to do.
When you fill out an exemption form to travel, there's an option for visiting family. So under what circumstances would a person be granted an exemption for visiting family at this point in time?
So right now we do allow for immediate family to visit. That's so a spouse or equivalent, I guess, and for dependent children to be able to be reunited with family. So those are the family that will be allowed to visit at this point. And that's been like that since the start.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi, good afternoon. Rotational workers, I'm sure there's more than one who will be arriving home, say, on December 20th, which means their 5-day testing period would be Christmas Day. Are the testing centers going to be open at those times? What are their options?
We're a 24/7, 365-day-a-year operation, Peter, so testing will be available on any day of the year, holiday or not.
Great, thank you. And rapid tests, I assume they're in circulation now, and so what sort of usage are they getting?
I missed a little bit of that.
Rapid tests?
Yes.
The quick tests. Are they getting, what sort of usage are they getting now in the province? Are they?
Okay. We have 3 different kinds of rapid tests. One has been deployed in Labrador now for some months, and that's the Gene Expert. That's been used in Labrador on several occasions. The other 2 are coming in small numbers through the federal supply chain. That's a rapid PCR. I think it's called ID Now, and then there's another one which is an antigen test. Certainly the rapid PCR, the kits and the equipment has arrived. That is currently being set up, and that under the agreement with the federal government is to be deployed to rural and isolated communities for outbreak management. As yet, it hasn't been used.
Okay, thank you.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
I had a question about one of the cases that was announced on Sunday. We had a case in a man between 20 and 39 years old. It was travel-related, and he returned from Alberta. In the press release that we received, it never stated that person had been self-isolating. So I was just wondering, was the person involved in that case, was he self-isolating?
So I believe the person was self-isolating according to the rotational worker protocol.
Okay, perfect. Thank you. And earlier today, Pfizer released some more data about their vaccine trials, and now they're saying that their vaccine is 95% effective, and that they're planning to ask the U.S. government to allow emergency use of the vaccine. And Dr. Fitzgerald, I'd just like to get your thoughts on what was announced by them, and do you think that if the United States were to allow emergency use, would that kind of speed up the process to getting a vaccine getting a vaccine in circulation here in Canada?
So, the reports that have gone out to the media are, not, we haven't seen detailed information about just what that is based on. So I can't really comment. I haven't seen it anyway. I can't really comment on that. And with regard to approval of a vaccine here, that is left to the very capable people at Health Canada, and I certainly would not presume to speculate.
Thank you.
Our next questions are from Mark Quinn of CBC News. Please go ahead.
Mark, you there?
He's muted.
Do we still have Mark Quinn on the line?
Oh, yes, sorry. Mark Quinn here.
Go ahead.
Yes, I have a bit of a follow-up. When I asked about the person who we didn't know the source of the virus for as of yesterday, I think I heard Dr. Fitzgerald say we've identified the source and it's contact with a traveler.
Mm-hmm.
And if I heard correctly, could Dr. Fitzgerald elaborate on that?
So the person yesterday was a contact of a traveler who has subsequently tested positive.
So wouldn't that be transmission, local transmission or community transmission?
So, I mean, it is transmission from one person to another. It's not community transmission, though, in the strictest sense that we're thinking about it is in transmission. The way that community transmission is being used, I think, in general, it's more about us finding cases that we cannot relate back to either another case or to travel or to an outbreak or cluster. So, so that would be what we call non-epidemiologically linked cases. So we don't have any cases of that type here at the moment. Those, of course, are the most concerning types of cases because they can be an indicator of more widespread community transmission.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. When it comes to a COVID-19 vaccine, obviously I know the federal government is the one lining these up, but how many doses would Newfoundland and Labrador be privy to begin, rolling out and distributing vaccines?
So all of those details are still being discussed and in flux, and it very much depends on what happens at the federal level and how much vaccine is received there. So we really can't talk about those numbers at this point.
Just from a health minister's perspective, this has been a topic of discussion because at one point there was a suggestion the federal government might want to channel vaccine to areas of hotspots at the expense of areas where the numbers were low. I and certainly my colleagues in Atlantic Canada at the health minister's level made that very plain that we felt that at least a population allocation had to be made. And we are, depending on the numbers you use, 1.4% or thereabouts of the Canadian population. And regardless of numbers of cases, we should get that allocation. So as the feds get their doses, we get 1.4% of it. And we were very plain about that because there was some doubt in their minds at the beginning.
So just to clarify there then, there's no longer doubt there that it would be by population?
That's my...
Yeah, well, it's still being discussed at very high levels, but our intention would be to ensure that Newfoundland gets its fair share and it reflects the vulnerable populations that we have here, quite frankly. When you're kind of triaging the distribution of vaccines per capita is important, where the disease exists is important, but also considering the vulnerability in the at-risk populations is yet another variable to be considered. And these are all things that Dr. Fitzgerald has said is being discussed at her level, is being discussed at the federal health minister's level, and I can tell you it's being discussed at the First Minister's table as well.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi again. Can you talk a little bit about how distribution is going to work, how you're envisioning this? Because in terms of, have you begun planning for who would get the first doses, how that rollout would look like?
So all of those discussions are ongoing and they're happening right now. Again, we don't have any finalized plans for that, so we can't really discuss that before we do get to that stage. But, we have a very well-established program of vaccine distribution, so we'll certainly be availing of that, what we already have and what works well. There will be some challenges with the some of the early vaccines with being frozen, and so we're working through some of those challenges as well. But as soon as we have finalized results, as soon as we know our final numbers and we can get that information out to people, we will. But it's still in discussion stages at this point.
And just in terms of, just curious, who are these discussions happening with? Is this with the federal government? In terms of where we're at, what's the process look like right now?
So, as the Premier and the Health Minister said, these discussions are happening at all levels of government and at FPT tables. They're happening at the Special Advisory Committee table. They're happening in our own province, at the department here, and you know, so they're happening at every table now. This is the topic of discussion everywhere. When we have more information, I guess we'll be able to share that.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi, I just wanted to follow up a little on vaccines, and I know this is a bit of a crystal ball question, but looking further down the road, up to a year down the road, how do you foresee pandemic restrictions being lifted, assuming the vaccine actually kicks in? Is there anything that would you think would actually still be implemented?
So I guess it depends on what's happening, not just here, but elsewhere in the world, elsewhere in the country. So it's about, what percentage of the country decides to get vaccinated, which we hope will be in excess of 60 or 80%. It's really about what's happening elsewhere in the world with regard to travel restrictions and, international travel and those sorts of things. So the vaccine hopefully will be able to help us protect our vulnerable populations most urgently, and that certainly will help us feel, a little more reassured if we do get outbreaks, that if our vulnerable populations are protected, that's helps us feel a little bit better about things. But, it is very difficult to predict what's going to happen in the coming months.
And older people apparently are doing quite well on the Pfizer one from the early signs. So, and the other thing I wanted to ask is, you're talking about restaurants and bars. Do you see any signs through other sources like the online tattle form, that sort of thing, that compliance is starting to wane?
We're just hearing reports, and there are various ways that we get those reports. So I think any time that we are hearing some of these types of things, it's just a good idea to remind everybody that we need to really, remain vigilant and make sure that everybody is following the guidelines and trying to reduce the risk as much as possible.
We'll now go to our final round of questions. So, Richard Duggan, do you have any final questions?
Yes, we're hearing rumblings of a potential COVID situation in Grand Bank. So I was just wondering, does the provincial government have, what sort of measures does the province have in place in Grand Bank?
So, public health in Eastern Health is certainly doing investigations and following through on any contacts and doing contact tracing as they normally would. And that process has been ongoing, since the beginning of the pandemic. So all of those things are in place in all areas of the province. Minister, if you were...
No, all I was going to say is that each regional health authority has contingency plans were a situation to develop in a particular location. So we have distributed resources like public health nurses and practitioners on the ground. And were there to be a case in any regional health authority where there was felt to be a need, there are additional people who could be brought in for, contact tracing if that was necessary, or infection prevention and control if that was necessary. So we have fairly robust mechanisms in each of the RHAs.
Thank you.
Mark Quinn, do you have any further questions?
Mark's on mute again, I think.
Yeah.
Kellyanne Roberts, do you have any further questions?
Yes.
Sorry,
Dr.
sorry,
Fitzgerald. Oh.
Kelly, you go ahead, and I'll come back to Mark.
Thank you. I'm sorry.
Okay. Okay. Dr. Fitzgerald, I'm just going to circle back to point of entry testing one last time here. I just want to clarify, so we have everything in place to do this if we were wanting to at this point. So we have the testing, we have the training, all of that.
So point of entry testing is not something we're considering at this time. If at any point down the road we were to consider point of entry testing, well, certainly we would have, we would have to make sure that all of that was in place. But it's not really something we're considering at this point.
Thank you.
Mark Quinn, go ahead.
Thank you for your patience. I didn't turn my mic on. I do have a question. Can we say how many people are using the COVID app in Newfoundland and Labrador?
The short answer is no. Because of privacy concerns, all that happens is we get a global figure for Canada as a whole. I haven't seen an update within the last 7 days, but the last figure I did see slightly prior to that was 5 million. So in actual fact, I'm glad you mentioned it, because this is another piece of defense. Your choices really, if you want to be a good citizen, are either to download the app and use that, or alternatively to diligently write down everybody you spend more than 15 minutes with, less than 6 feet apart, for the last 14 days and keep it current and up to date. I do know people who've done this. It is very time consuming. But if that is, if you're concerned about contact tracing and want to contribute, those are your two ways of doing it.
And as a follow-up, do we know if anyone in Newfoundland and Labrador who's tested positive is using the COVID app?
We wouldn't know that because the app doesn't tell us. It tells the individuals concerned. It's a totally anonymized system, and it relies on the individuals seeking a code to unlock their phone if they are positive, and then those people whose phones are alerted seeking advice from 811. It does not involve the Department of Health, the regional health authorities, or anything. It's a totally decentralized model to satisfy the requirements of the privacy commissioners. So we wouldn't know.
Thank you.
Patrick Butler, do you have any final questions?
Yeah, I have one last follow-up. I just want to make sure I understood clearly. When we're saying that, did we obtain, or did you obtain a promise, or is this something you're advocating for? We say that vaccines would be distributed on a population basis rather than a number of cases basis.
I think what we've said collectively is that no final decisions have been made on the distribution, but these are all things that are being talked about at all the tables across the country and weighing different variables in the decision-making analysis in order to ensure that the vaccine is distributed appropriately for the most vulnerable across Canada.
Okay, but it's fair to say that on a political level, this is something that you're advocating for.
We're all advocating for Newfoundlanders and Labradorians. That's our job. But these are decisions that are being made based on scientific evidence and are being made through a combination of tables, not just one table, but a combination of tables across the country right now.
Thank you.
And Peter Jackson, do you have any final questions?
No, I'm good. Thank you very much.
Thank you. I'll turn it back to you, Premier, for some closing remarks.
Well, thanks everybody, and the final message is, of course, to continue keeping up the hard work at home. This will definitely be a different Christmas season, but if we continue to follow the advice of Dr. Fitzgerald and Dr. Haggie, we will have what I hope to be a safe and family-based Christmas that we can all celebrate appropriately, and get your flu shots.
Thank you very much, Premier. Thanks for tuning in, folks. We'll join us again next week on Wednesday at 12:30 p.m. Thank you.